Are you taking vitamin D every day to boost your immunity? Or maybe popping iron supplements and vitamin B12 thinking they'll help with your energy? What if I told you, especially if you have chronic kidney disease, these common habits could be damaging your kidneys instead of helping? Just one wrong pill, the wrong dose, or the wrong timing could push your kidney health in the wrong direction. Let's talk about how to get it right, before it's too late. When your kidneys stop working properly, it's not just about filtering waste. They also struggle to manage key nutrients, like vitamin D, iron, and vitamin B12. That's why so many people with chronic kidney disease end up deficient in these three critical micronutrients. And while the fix might seem simple, just take a supplement, it's not always that easy. In this video, we'll walk you through why these nutrients matter for kidney health, when and how to supplement safely, and the dangerous mistakes many people make when they try to self-treat. If you or someone you love is dealing with chronic kidney disease, this might be one of the most important videos you watch. Vitamin D is often praised for strong bones and immune support. But for people with chronic kidney disease, there's more to the story. You see, healthy kidneys help activate vitamin D in your body. When kidney function drops, that conversion gets disrupted, and that's when deficiency kicks in. Low vitamin D levels in CKD patients can lead to weak bones and muscle pain, higher infection risk, and even faster disease progression. But here's the catch, too much vitamin D can be dangerous. High doses, especially when self-prescribed, can cause calcium overload, kidney stones, and vascular calcification. In short, you may be doing more harm than good. So what's the safe approach? Don't guess, get your vitamin D tested. Only supplement under medical guidance. Include vitamin D-rich foods like fatty fish, egg yolks, and fortified dairy. And yes, a little sunlight each day, if approved by your doctor, can also help. Remember, when it comes to vitamin D for kidney patients, it's all about the right dose at the right time. If you live with chronic kidney disease, chances are, iron deficiency is something you've faced. But here's what many people don't realize, your kidneys help trigger red blood cell production. When kidney function declines, your body produces less erythropoietin, or EPO. That's the hormone your bone marrow needs to make red blood cells. Without it, even if you eat enough iron, you can still develop anemia. That's why many CKD patients feel constantly tired, weak, or out of breath. So the answer is simple, right? Take iron supplements. Not so fast. Self-medicating with iron, especially without testing, can lead to iron overload, damaging your liver, heart, and yes, even your kidneys. So how do you do it right? Heavy checkmark: get your ferritin and TSAT levels checked. Heavy checkmark: only supplement when your nephrologist recommends it. Heavy checkmark: if you're on dialysis, iron is often given via 4, not by mouth. Heavy checkmark: and if you take oral iron, don't mix it with calcium, milk, or antacids, it blocks absorption. And always remember, fatigue in CKD isn't always about iron, it could be low EPO, B12, or other factors. Don't guess. Test. Iron is powerful, but only when used wisely. Tingling in your hands. Trouble walking. Brain fog. These aren't just signs of aging, they could be symptoms of a vitamin B12 deficiency. For people with chronic kidney disease, this happens more often than you'd think. B12 plays a major role in heavy checkmark: protecting your nerves. Heavy checkmark: producing red blood cells. Heavy checkmark: in keeping your brain sharp. But when your kidneys weaken, or your diet becomes limited, vitamin B12 levels can drop. And in some cases, medications used in CKD can block absorption too. If left untreated, low B12 can lead to anemia that doesn't respond to iron, balance issues, memory loss, even permanent nerve damage. So what's the right move? Don't take a B12 pill just because you feel tired. Ask your doctor for a blood test. If you're truly low, they may recommend B12 supplements, or even injections. And if you're vegetarian or over age 60, check your levels more often. Bottom line, B12 may be tiny, but its impact on your kidney health, brain, and energy is anything but small. It's easy to walk into a pharmacy and grab a bottle of vitamin D, iron, or B12, especially when you're feeling tired or weak. But for people with chronic kidney disease, self-medicating can be risky. Your kidneys aren't working like they used to. They can't filter out excess nutrients the same way. Taking the wrong vitamin, the wrong dose, or combining supplements without medical guidance can lead to vitamin D toxicity, causing calcium buildup and kidney stones. Iron overload, damaging your liver and raising blood pressure. Unnecessary strain on already weakened kidneys. Many people mean well, but take multiple supplements at once, without realizing they contain overlapping ingredients. What you think is helping, might be hurting. So before you swallow that next pill, ask yourself. Have I had my levels tested? Has a doctor recommended this? Am I just guessing, or following a TikTok trend? Because your kidneys deserve more than guesswork. They deserve precision. At the end of the day, vitamins aren't magic pills. And when you're living with chronic kidney disease, the way your body handles them changes. That's why even the most common supplements, like vitamin D, iron, or B12, can help or harm, depending on how they're used. So here's your roadmap. Get tested before you supplement. Work with your kidney doctor, not just a YouTube ad. Understand that CKD management is about balance, not extremes. If you learned something today, help us reach more people. Tap the like button. Subscribe for more trusted health tips. Share this video with someone who's taking care of their kidneys. Because real health doesn't come from guessing, it comes from knowledge. Stay strong. Stay informed. And take care of your kidneys.